Assalamualaikum warahmatullahi wabarakatuh. So guys, I want to introduce myself. My name is Aruna from Faculty of Medicine, Sultan Agung Islamic University. And now I will present the formula, the CONSORT, checklist, abstract, and full text from an article. The title of the article is The Effect of Fecal Microbiota Transplantation on Abdominal Pain, Stool Frequency, and Stool Form in Patients with Moderate to Severe Irritable Bowel Syndrome. Result from a randomized double-blind placebo-controlled study. And the first CONSORT checklist of abstract, and then ini abstraknya. And then the table item to include when reporting random trial in journal or confer abstract. And the first of title is randomized, and others, and then trial registration, and then method participant. The study include and then method participant 52 adult patient with moderate to severe IBS, and then result outcome. There is no statistically significant difference were found between groups at any time during the study for any of abdominal pain, stool frequency, and stool form. And then conclusion, there is in this analysis of results from a randomized double-blind placebo-controlled study, we found no clinically beneficial effect of FMT on abdominal pain, stool frequency, or stool form. And the last is funding. Funding is the study was financed by grant from the private foundation. There is a checklist of the abstract, and then CONSORT checklist on the full text. The title is The Effect of Fecal Microbiota Transplantation on Abdominal Pain, Stool Frequency, and Stool Form in Patients with Moderate to Severe Irritable Bowel Syndrome. Result from a randomized double-blind placebo-controlled study. In the first identification as a randomized trial in the title. As we can see from the title, there is the word randomized, and then a structured summary of trial design, method, and result. Then trial registration number, and then method and result. And then scientific background and explanation of rationale. There is irritable bowel syndrome. IBS is a chronic gastrointestinal disorder with a global prevalence. And then participant, there is individual between 18 and 16 years of age with a diagnosis of ABS based on the wrong 3 criteria. And then method, there is a description of trial design. There is a participant wearing the mask in blocks of 4 and allowed to treatment with FMT capsule or placebo capsule. And then measures is intervention. There is day 6 or 12 covering the last week of treatment with FMT or placebo from her on cold-down treatment. Days 30 or 19 covering the week following treatment, post-treatment, the week prior to the 1, 3, and 6 month study visit. The duration of 7 days for each time period was chosen to minimize any bias caused by a possible fluctuation in symptom severity on weekdays as offset to weekend. And then sample size, there is include 52 participants based on effect of placebo and effect of FMT with a power and an alpha for intention to treat analysis. And then a result randomization, there is the participant were randomized into two groups of 26 participants for treatment with FMT or placebo. There is a baseline data. Ini. And then participant flow. There is participant flow. And then in calorie analysis, there is in clinical studies of patients with IBS, the placebo response is generally known to be high, partly due to the use of subjective outcome measure. And then in the study, we analyze the data from the participants included in the study by healthcare. In an analysis of within group change, we found the placebo group to be stable throughout the study with very little. And then although a high placebo response is a possible explanation for the improvement observed in both groups in the study by healthcare. And then limitation, there is this study also has limitation. First and foremost, the study participants did not keep a daily tracking their symptoms and bowel movement prior to treatment with FMT or placebo. For that reason, we do not have data from baseline to compare subsequent measurement. And then the last is funding. The study was finished by grants from the private foundation. Thank you.